Hello, everyone. This is Annalisa, your friendly acute care nurse practitioner. And today I want to talk about reasons to get a COVID-19 vaccine. This came up in conversation a few weeks ago where someone asked, well, if I wear my mask and I social distance and I wash my hands, why should I get vaccinated? What's the point? And I think it's really important to answer this question. So today I present you with 7 reasons to get a COVID-19 vaccine now if you haven't been vaccinated already. Just to be clear, as I give some data and statistics in this video, I'm referring specifically to the mRNA vaccines, namely Pfizer and Moderna here in the US. So let's jump right in with reason number 1. Vaccines are the only protection if you're exposed to COVID-19. So masks, physical distancing, hand hygiene, very good tools to try to prevent you from becoming exposed to the virus. That being said, they're not perfect. The Delta variant is 50% more contagious than the variant we were seeing last year. And even if you do all of those preventative measures correctly 100% of the time, there's still a chance you can get exposed to the virus. If you are exposed to the virus, the only thing that you can have done in advance to help yourself is to be vaccinated. I know that on social media right now there's a ton of information out there about immunity boosting supplements and foods, and sorry guys, but there's just no scientific evidence to support these claims. Experts in immunology say that doesn't matter how much juice you drink, what you eat, or what supplements somebody sells you, none of those things are going to protect you if you're exposed to COVID. The one and only thing that you can do to show your immune system what COVID is and get it ready to fight COVID if you're exposed is to get vaccinated. Reason number 2. Vaccines provide protection from severe disease and death. So data shows that vaccinated individuals are much less likely to need hospitalization or to die from COVID, including the Delta variant. You may be hearing about breakthrough infections amongst the vaccinated, and let's put this in perspective. The vaccine is not perfect, just like masks and hand washing aren't perfect. We knew from the beginning that some people who are fully vaccinated will still test positive for COVID. Most of the people who are fully vaccinated and who test positive for COVID have no symptoms at all, or they have mild symptoms. This is a huge difference from people who test positive for COVID who are not vaccinated and who become seriously ill, who have to get admitted to the hospital, who have to get admitted to the ICU and placed on a ventilator, or who die from COVID. So there's so many studies going on, but it's safe to say right now that we know this. If you're not vaccinated, you're 5 times more likely to get infected with COVID. If you're not vaccinated, you're 10 times to 29 times more likely to get hospitalized with COVID. And if you're not vaccinated, you're 11 times more likely to die from COVID than those who are vaccinated. Reason number 3. When you're vaccinated, you don't just protect yourself, you protect others around you. More than 20% of the US population is children under 12 years old who are not eligible for any vaccines. There are also plenty of adults who have certain health conditions that impair their immune response and make them more vulnerable if they're exposed to COVID, whether or not they're vaccinated. So the more adults and teens who get vaccinated, the more herd immunity we'll have, the stronger a wall of protection we can build around our entire community to protect those people who are more vulnerable. If you think that becoming infected with COVID is a good way to become immune to it, I'm going to tell you why that's a bad idea. And it's a bad idea because If you become infected and you're not vaccinated, you risk, first of all, getting severely ill and dying. You also are contributing to the spread of the virus so that it keeps going on. And the more people who become infected and spread COVID, the more chance this virus has to mutate and just keep getting more serious and more dangerous for everyone. Reason number 4, easier access to activities or a return to quote-unquote normal pre-pandemic life. So right now, you guys are seeing in the news, if you want to travel to many countries, if you want to attend certain events, if you want to keep your job, it's going to be required that you're vaccinated. This is not a government conspiracy. This is purely because vaccines are safe and effective, and COVID is killing people. So I think it's a lot more convenient and makes a lot more sense for people to get vaccinated than to quit your job and find a new one, or to not travel where you want to go and not attend your events, or to go and get yourself tested every week or maybe even more frequently every time you want to go somewhere or do something. And let's remember, the more people who are vaccinated, the more likely we can end restrictive measures. If we don't allow another surge to happen, maybe we won't have to have lockdowns again. I don't know about you guys, but some of us would like this pandemic to end at some point. So please, get vaccinated. Reason number 5. Colder weather is coming in many parts of the country, and we know what happens in the winter. That's when viruses flourish because more people are spending time indoors, we're breathing the same air, and there's not as much ventilation. So again, if you want to boost your immunity now, get vaccinated now. Remember that these vaccines will take 2 doses, 3 weeks apart, and you'll be considered fully vaccinated 2 weeks after your second dose. So if you want to protect yourself, your family, your community before the cold weather hits, act now. Don't waste any more time. Reason number 6. These vaccines are free and they're easy to find. Unlike in the beginning of 2020 when you practically had to win the lottery to get a vaccine appointment, these vaccines are widely available now at almost every pharmacy in every neighborhood, mostly every doctor's office, and many sites set up by your local government. So the federal government is picking up the tab for these vaccines because the fewer people we have getting sick and dying of COVID, the better it will be in the long term for our economy. It's not a conspiracy. They're paying for it because it will help our country. So you really don't have any excuse. You don't have to pay for it, and you probably walked past a pharmacy that's giving them out for free just today. And number 7, COVID vaccines are safe and they're effective. This is where some people who are hesitating might not be so sure. There's a lot of misinformation out there right now. And please, guys, don't be fooled. Misinformation is a for-profit business, and the people putting it out have nothing to lose when unvaccinated individuals get sick or die, but they have everything to gain by getting clicks, using eye-catching titles, and trying to fool you. This misinformation is deadly. These are the facts. Over 1 billion doses of mRNA vaccines have been given worldwide. They've been in continuous clinical trials for more than a year, starting with Pfizer's trials that began in July of 2020. And the mRNA vaccines were not rushed. They are actually the most well-studied vaccines in U.S. history, and safety monitoring has not stopped. It is ongoing. After all of this study and all of this time and billion doses, this is what we know. Serious side effects from the vaccine are extremely rare. If you compare the risks of taking a vaccine to the risks associated with actually getting infected with COVID, it's far worse and far more frequent to have side effects from COVID infection than from a vaccine. The Pfizer vaccine is FDA approved, which is not easy to do. The Moderna vaccine applied 3 weeks after them, so it's expected that they might soon be approved. If you know a nurse or a doctor who works in a hospital, go ahead and ask them, is their hospital full of COVID patients, or is it full of patients who are sick from the vaccine? And see what they say. 96% of every single physician in the U.S. is vaccinated. So we're putting our money where our mouth is. We're not just telling you to do it and not doing it ourselves. People in healthcare, scientists, and qualified people who understand the risks of COVID versus the risks of the vaccine, they've made their decision. And hundreds and millions of Americans are safely vaccinated. I promise you, the people telling you not to get vaccinated are not the ones on the front lines of this pandemic, and they don't know the truth of what COVID does. So please, guys, get vaccinated now. And if you have any questions, if you want me to address any more myths or misinformation, just let me know in the comments, and I'd be happy. So everyone, stay safe, stay healthy, and get vaccinated. Peace.